Hello, everyone. It's Monday, October the 19th. And, a day that surely always resonates with me. It's my mom's birthday, and I lost my mom a good many years back, and bless her. I just think about her an awful lot. Taught me a lot of really good stuff. But today I've got to announce we've had 3 additional deaths in West Virginia. We're up to 399 deaths. All 3 of these deaths occurred on last Friday, came in last Friday to us. I'm pleased with the fact that we didn't have additional deaths on Saturday or Sunday, and we have not been advised of additional deaths so far this morning. So, when it really boils right down to it, though, for these families, being pleased is anything but the case. And so we've now lost an 84-year-old female from Grant County. Our 397th death, our 398th death was a 73-year-old male from Fayette County. And our 399th death, a 59-year-old female from Cabell County. Like I said, every time, over and over and over, these families are really hurting West Virginia. That's all there is to it. These have been wonderful, wonderful people that have been great West Virginians, and they have given us so much. It's unbelievable. And absolutely, they deserve to not feel alone. These people do not need to be a statistic. So please, please, show them, and the good Lord above will instill in them a feeling that we're with them. If we'll just say our prayers and let the Lord above take care of the situation, and we will just show, all of us will show in our unisons that how much we care and how much we hate it for these families and these great individuals. So please keep them in your thoughts and prayers. Our new positive cases in the last 24 hours were 212 cases. That's a positivity rate of 2.21. Our cumulative rate is 2.83. Both those are the envy of the nation, but at the same time, they're higher than what we want them to be in West Virginia. Our active cases have now gone above 5,000. A big part of that is the simple fact that we continue to test more and more, and that's really, really good, and that will pay great dividends as we go forward. Our recovered cases are 14,799 people have recovered in West Virginia from this terrible pandemic. We have 177 people hospitalized right now, and our effective reproduction rate, remember, it had dropped down well below 1. Now it's at 1.03. It's still the 9th best in the country, and I want to talk just a second about that. Being above 1 is not good. We absolutely should keep that in our thoughts all the time. We don't want to be even close to 1. We want to be at 0.89 or 0.91 or 0.85. We want to be significantly under 1. We don't want to be at 1, and we don't surely want to be at 1.03, and we absolutely don't want to be at like 1.36 or 9. Where we were the worst in the country. At 1.03, why are we the 9th best in the country? And the answer is just as simple as mud. All you've got to do is turn the TV on and look. This disease is running more rampant every day across our country, and absolutely we are having numbers like almost 60,000, or maybe even in excess of 60,000 positive tests in the United States, in the last few days. So, while we're still 9th best in the country, that's good. We should all realize that this dreaded killer is now ramped up across the United States, and that includes across West Virginia. So we want to stay on our toes. West Virginians, please, please wear your mask. Please listen to all the guidelines. Please, please take care of yourself, because this thing will bite you, and absolutely we will not be able to get it off of you, because it gets some of us, and naturally we're better in a lot of places, but we just got to watch. Today we have a bunch of counties that are in the orange. Wyoming County has turned red. You know, my family roots are in Wyoming County, and we just need more and more testing. I don't know what to do. I mean, I tell and I tell and I say, we got to test. And I know in Wyoming County, maybe last week, Dr. Marsh was reporting to me, you know, we had tests like 16 one day, 52 another day, 19 another day, 51 another day. Well, that's not going to cut it. That's just not going to cut it. You know, then when you have just a very few positive cases, it just sends you right off the chart. So, in other words, we've got to test more. More people have got to step up in all these counties and all across West Virginia and continue to be tested. You have got to do that, because it will be the only way that we find the spreaders. And if we can find the spreaders, we'll make life better everywhere. We will not only save lives, but we will make life better everywhere if you will test and we can find the spreaders. Today we have 10 orange counties: Morgan, Berkeley, Doddridge, Jackson, Wirt, Pendleton, Clay, Wayne, Mingo, and Monroe. I just sound like a broken record. We've got to some way continue to test. I am telling the National Guard, I am telling everybody on our end that whatever we have to do, we have to make that testing available and absolutely continue to test more and more and more. It is the only answer for us, and it will absolutely pay great dividends. Our education map came out on Saturday at 5 p.m. We had one red county, which was Doddridge. We had 7 orange counties on our education map, which was Morgan, Berkeley, Wirt, Upshur, Randolph, Mingo, and Wyoming counties. We had 5 gold counties: Marshall, Jefferson, Wood, Gilmer, and Pendleton counties. All the rest of the counties naturally were in the yellow and the green. You know, we just have to do any and everything we can to help one another and try to stop this stuff, because at the end of the day, you know, it's we want to be in school. We want our athletes to be able to play ball. You know, I've got on the ground firsthand information of how it feels for our athletes to work as hard as they work and then not be able to play. I mean, just imagine, my basketball team, my girls team was getting ready to make a run at having a real shot to win the state tournament. Many of them had never been to the state tournament before, and it was a big, big time deal. They came down the night before and they stayed in Charleston, and they were getting ready to play that evening against Martinsburg. And just to tell it like it is, we had played Martinsburg earlier in the season, just a few weeks before, and we'd beaten Martinsburg by 25 points, and it surely looked like we'd have a really, really good shot at being on the way to the semifinals, and then from there, you know, anything can happen. And all of a sudden, the right thing was to shut the state tournament down. And we did. And so I know how much it means to kids. I'm a coach, I get it. But at the same time, you've got to know just this, that in those counties, whether you may think you have it, don't have it, been tested, whatever it may be, in these counties that turn red and orange and everything, first and foremost, we need to be going to school. School is way more important than playing a game. Absolutely, way more important. But then right behind that, what is more important than even going to school? And that's really finding the people that are the spreaders so we can stop people from dying. So there's so many different variations of this, and I feel everybody's pain and everybody's frustration. There is no right answer. Juggling these balls is difficult as difficult can possibly be. We're trying with all in us to do the right things, and I appreciate the effort of our athletes. I appreciate absolutely all those great teachers and everybody, all the kids that are in our schools, and I appreciate all the frontline workers that are trying to find these spreaders and stop this thing. Everybody is doing the very best that I know we can possibly do. We have 19 outbreaks now in their schools. We have 59 confirmed cases. To be perfectly honest, we'll continue to run to those fires and everything, and that's really not bad at all. Our free testing will be up on our screen, and it's available, without any hitches whatsoever, and it's all over the place, you can see, and so please try with all in yourselves to go get tested. Our red and orange county testing today will continue to offer free testing in our red and orange counties today. I encourage everyone to go do that. Our drive-through pharmacy testing as a part of this has been a great big step up from Walgreens and Fruth Pharmacy, and I know I can't pronounce that very well, but I appreciate them more than you'll know, and I thank them, and they've got all kinds of locations all over the place and everything, and all you got to do is just go on our website and you'll find where to go. Our long-term care facilities, we have 43 outbreaks today. In our churches, we have 18. It keeps on moving up, everybody. Active outbreaks that are reported in 13 counties, and these counties are Berkeley, Doddridge, Harrison, Logan, Mason, Mercer, Monroe, Nicholas, Putnam, Upshur, Wayne, Wetzel, and Wood counties. Again, we all know that church is a place that absolutely this killer can really thrive. We're singing. We love to see all those that we love and that are in our church family with us and everything. And it's an absolute place where a lot of our elderly go, and we just got to watch. We just got to wear a mask, stay, a pew apart and all that. And from the standpoint of our elderly, just think, if you can get your services online or something like that, or some way, somehow, it may be exactly the thing to do. From a corrections update, we have 12 cases now, and currently that are in 3 facilities, and we have 14 staff cases. I encourage you like crazy to go get your flu vaccines. Across our nation, that has really significantly moved up, where people are getting their flu shots, and that's really good. We have a total of $153,195,000 plus some change that has gone out or been awarded now to our cities and counties. That's good. We need them to continue to apply. Now, I want to talk to you just 1 second about the National Guard. The National Guard today received or just over the weekend or whenever, received authorization from FEMA to increase the number of personnel on federal activation status to 400. And that will help us, and the federal reimbursement is at 75%. Currently, there are 379 members of the Guard on duty. with additional service members available to provide assistance to the state when needed. Now get this, this is the stuff I want to really get into. As of today, the Guard has provided the following for the citizens of West Virginia. Now I want you to really dial in and listen to this. They have distributed 19,311,600 pieces of PPE to all 55 counties. They have performed 48,430 COVID tests all over the place. They have conducted 632 vehicle disinfections and 161 facility disinfections in 22 counties. They have trained 834 businesses and 111 long-term care facilities or medical practices and 4,800 civilians on COVID prevention. And they have made 220,639 pieces of PPE. Today, you can just see, and I'll review because I'm so proud of them. They've distributed 19 million pieces of PPE. They've performed 48,000 tests of COVID testing. They've conducted 632 vehicle disinfections and 161 facility disinfections. They've trained 834 of our businesses and 111 long-term care facilities, 4,800 civilians on COVID prevention, and they have made 220,000 plus pieces of PPE. I'm telling you right now, if there is a state with a better National Guard, I'd love to see it, because I'm telling you, these are champions beyond belief, and what an incredible job they've done. All West Virginians should be so thankful and so grateful that we have them, and we just are going to continue to use them, and I know they won't quit. They will not quit till this is over. Neither will I, and absolutely, I keep telling everybody what a wonderful job they've done. Now, if we could look real quick at the charts and then I'm done, you can see the top line. We want that to widen, those two lines, and continue to widen more and more and more. It's okay, but it can be better. The next one is our daily rate, and you can see it's dropped down under that dotted line now and everything, and it kind of just keeps bouncing and bouncing and bouncing. But if you look, we got more days in the last 2 or 3 or 4 weeks or month. We got more days under that line than we've had back, where it jumped up for about 30 days there, significantly above the line. And our cumulative positive rate, it looks pretty flat. We want that under 3%, and it's at 2.83, but at the same time, we'd really, really, really love to see that, start dropping down even more. But really, that's all I've got right now. Thank you all so much.
All right, thank you, Governor. Let's first today go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's always great to be with good people of West Virginia. As the governor said, we know around the country that we are starting to see a very strong uptick in the spread of COVID-19. We have had over 65,000 cases in a single day, which is the most we've had since the spike that we saw over the summer. And what's really concerning even more going into the winter and the flu season is the distribution of the testing that we've seen in West Virginia and we're starting to see around the country. In West Virginia and around the country in the summer, we saw a younger group of people be mostly affected with COVID-19. And as I reported in April, the average age of somebody testing in Florida with COVID was 65, and by July it was 35. Well, in West Virginia, we also saw a younger demographic of people that tended to have more COVID positive tests in the summer. But now, when you look at our 7-day trend across the age demographics, it's really very evenly spread. And that suggests that now we're seeing all age groups starting to be affected by the spread of COVID-19. And as we've talked about many times, West Virginia has an extremely vulnerable citizenry. And as Kaiser Family Foundation pointed out, we were one of, if not the most vulnerable state going into this. So it's really even more important than before that we really start to focus on what can we do. And there's been a lot of debate, not only in West Virginia by many people, but also nationally about what is the best strategy to be able to reduce the number of COVID infections in a state and in each county of a state. And just as a real quick review, we talked about initially was the hammer, the idea that the governor had an executive order for stay at home to try to reduce the spread of the virus. But then we came out, we wanted to do things at a more precise level, at a county level, and start to look at each county as an individual entity, of which 55 make up the state of West Virginia, and start to target our approaches there. Initially, we did borrow, at least in some ways, from other public health experts, including the Harvard Global Health Institute, and then took a map and a strategy that just looked at how many new positive cases did we have on a 7-day rolling average, or if the county was really small, less than 16,000 population on a 14-day rolling average, corrected that for 100,000 population. And while that definitely gave us a perspective on how COVID was spreading and which counties were doing better than other counties, the challenge with that, it started to reduce people's incentive to test, because the more positive tests you have on a daily basis, the higher that rate goes. And that rate doesn't have any accounting for how many tests that you do. And so as we looked at that, we saw only sicker people getting tested. About half the number of people ultimately got tested than were tested before. And we've talked a lot about these super spreaders, the small 5 to 9% of people that infect the other 80%. And the fact that many of these people are spreading COVID without knowing they have it in the asymptomatic or pre-symptomatic period. We were also seeing the death rate go up. We're seeing our RT value go way up. And we were starting to see that many counties in West Virginia were getting into more and more problems in which they couldn't get out. And it started to reduce the use of this map and this strategy to try to incentivize people to continue to work to reduce in an ongoing basis COVID in their community. And that's when the governor challenged us to go and add a second rate, the percent positive rate, which really looks at the number of positive tests on a daily basis relative to all the tests that were taken on that daily basis. And as has been pointed out, our number of tests has risen pretty dramatically, 2 to 3 times. We're now over 7,000 tests a day, and we were a bit under 3,000 tests a day before we added this metric, which is fantastic. But the thing that's been pointed out is we're seeing even more positive people. And I take that to be really, really good, because ultimately we have 2 powers to be able to defeat COVID in each community. One power is test, identify the super spreaders, do the appropriate contact investigation, and continue to try to focus on the counties with the most activity, the red, orange, and gold counties, but also on the areas where people have the highest risk of dying, like nursing homes and other vulnerable populations. But the second power that we have, which is something that we just want to remind each person of, is we know if people wear masks and physically distance and avoid crowds, closed indoor spaces, and contact for greater than 15 minutes, 6 feet or less from people that you don't live with all the time, we will be able to reduce the risk of COVID spread like we will when we have a vaccine. And I really want to make this point that we can argue that, since we've done this, we've seen many more tests. We've seen our RT value increase. We've seen our death rate decrease, which is exactly what we want to see. And we've seen many counties be able to turn around some of these metrics. When we test a lot and identify positive people, the percent positive rate, if we do a lot of tests, will initially go down, and the infection rate or the incidence rate will initially go up because, again, the incidence rate does not take into account the number of tests that you've done. But over time, when we control the spread, both of those go down, and we've seen that in every community. And we could argue that each West Virginian should do the mitigation measures, wear masks, stay physically distanced, wash your hands, avoid the 3 C's because of all these things. But I would really, really plead with the folks of West Virginia. COVID is starting to rise its head, and it's going to get worse. Michael Osterholm says the next 6 to 12 weeks will be the worst that we've seen as we get colder and go inside. And West Virginia, this is what we do. We serve each other. We love each other. We protect each other. And to do that right, like we've done in the wars, like we've done mining the coal to build the steel that fueled the Industrial Revolution and the war efforts, it's really important that even more than ever, we take every precaution, because it's not just your life you're saving, you're saving the lives of people in our vulnerable communities. So thank you for all you're doing. Keep it up. This is the time for us to demonstrate what real community and love and altruism is to each other. So thank you.
All right, thank you, Dr. Marsh. Next to the West Virginia DHHR with Secretary Bill Crouch and Dr. Ayn Amjad, our State Health Officer.
Sure. Good afternoon. I'll give an update on Bateman. We have had several questions. So currently, we're having testing today at Bateman Hospital. We are going to start doing testing twice a week. We do have a large staff there. We are currently having today and tomorrow. We have 29 active staff cases there and 29 active residents right now. We do have cleaning that did take place last week with our West Virginia National Guard. They did a couple of units last week, so we want to thank them for that. Cabell EMS is helping with the testing events there, so we also want to thank them for that. We also do want to thank our Bateman staff there for working very diligently. They are our heroes, going there every day, working with our COVID unit. We have 2 units set up there at Bateman right now, so we do know it's very hard to go in and work every day, knowing the dangers that COVID does have, but we're working very hard. We also know that there are some concerns with employees. We continue to talk with them and ask them. We want everyone to feel safe who work at Bateman, so we're providing PPE and any supplies that they need. Our West Virginia National Guard will also visit again, as well as myself, but those are our current numbers. If anyone has any further questions, we can answer them later. I'll leave it to Secretary Crouch if he has any other updates.
No, that's a good update. Thank you. So we're good, Jordan. Thank you.
Thank you.
All right, thank you both. We'll now go to questions from members of the media. Our first question today is from Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I'm going to read from I'm getting emails from students down in Boone County who are concerned about what happens if a school is allowed to be in school and they're in sectional or regional play in whatever sport I guess we have cross country coming up and some other sports. And then the following Saturday, all of a sudden they're in the orange or red. Does that mean they're disqualified from continuing in the playoffs immediately? And the other question I have here is about an exception. They wrote about the number 1 ranked single A runner in the state as a senior and a state defending champion who will not get to run his 2 races because he's from Doddridge County. I know there was an exception made for golf. It seems like cross country is a pretty socially distanced event. So if you could comment on both of those questions.
Mark, we had a call last night. I prompted the call to try to examine and look at anything we could possibly do to try to help. I would tell you that we're still working it. We're working it as diligently as we possibly can. This is a really tough situation, from the standpoint of the red and the orange counties. We've said if you go red or you go orange for the following week, that you absolutely cannot, we're not going to go back to school. We're not going to play sports. There are many different unfortunate events from not going to school, not playing sports. I get every bit of that and everything. The SSAC's trying. They're trying with all in them. Our Department of Ed's trying. All of our medical team's trying. But at the same time, we've got to remember, too, that what we're doing more than anything is we're not going to school. And that's a big undertaking right there. And on top of all that, we're every day coming in here and talking about the number of people that we've lost in this and trying to stop this terrible pandemic. From the standpoint of not going to school and not playing, that's where we are right now. We're continuing to try to look into it and everything. I totally understand the situation with the great young man that's in Doddridge County and all of that. And from the standpoint of all the different things, that we're doing, I guess cheerleading is we're still allowing the cheerleading, from the standpoint of in the orange counties and everything. I think now I've got to go back and check a couple things real quick on all this and everything, but we're sure looking at the distancing from the standpoint of the cross country, the contact sports and everything, the soccer, the football and everything, but we've got to surely look at differently, but we're trying to work it out. It is a very, very, very difficult thing because I know how much our kids and our athletes put into this, and I also know how badly we want to go to school. It is tough stuff. I mean, that's just plain all there is to it, but we're trying to do everything we can possibly do, and we're continuing to work it.
All right, thank you, Mark. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. I've had on my mind recently the reports that you and Dr. Marsh described about numbers starting to go up across the country. And I wondered if there are still regular calls with yourself and other governors and the White House, and what the tone of those calls has been recently. Thank you.
Well, to be perfectly honest, Brad, there's surely regular calls with us and the White House, because we're talking back and forth nonstop. From the standpoint of regular calls with the other governors, directly with the other governors, I have not had a lot of regular calls, back and forth with the other governors. But Brad, as far as our direct lines and communications back and forth with the White House on what's going on, we're talking nonstop. We're constantly monitoring everything that's going on all across our country, with our medical team as well as all of us from the governor's office to DHHR, and all of us are doing exactly that. It just boils down to simply, the more we can learn from other states and what's going on in other states, we surely want to learn. But at the same time, a lot of other states are really, what's happening more than anything is they're trying to learn from what in the world is going on and has gone on in West Virginia. Because when you just step back and look at it, I know we feel like, we're distanced in West Virginia. And so that's really given us all kinds of an advantage. But if you really are truthful, you're going to say, hold on here, no, wait. What does distanced mean? I mean, at the same time, you've still got 50,000 people right here in Charleston, West Virginia. And you've got the most elderly state in the country. And you've got the state that's got more, medical problems than any state in the country. And you've got a state that's right within a hotbed as far as all the other states all the way around it, and not an ocean around part of us. And yet, we're continuing to produce great numbers, and West Virginians should be really, really proud of that. So we absolutely want to keep a monitor on everything that's going on all across our nation. We want to take advantage of any and everything that we can possibly take advantage of that helps us on the good side. But really and truly, what's happening way more than not is the governors from all across this country are reaching out to West Virginia and saying, what are you doing in West Virginia?
All right, thank you, Brad. Next to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers here. I guess kind of related to that, I've seen for the last at least last 3 weeks that I've looked at the numbers. As she said, as Dr. Marsh said, our deaths are going down, and I was curious, and this could be for the governor or more specifically the health experts. But what are we attributing that to? Because obviously we still have high hospitalizations. I think we had peaked at one point last week. We're coming back down slightly from that, but we still are seeing pretty high hospitalization rates for us at the moment. But the death rate has gone down. Are we seeing more therapeutics get to the hospitals in West Virginia and kind of help change some of the outcomes that, say, a month or so or 2 months ago would have probably been certain deaths, but because of the level of therapeutics that are making it into the state and to our hospital systems, we're able to start saving more lives than what we were losing. Thank you.
Stephen, let me comment, and then I'm going to defer to Dr. Marsh and Dr. Amjad, but let me just say just this, that there's no question that the therapeutics are better, the medicines are better, from the standpoint of us knowing what to do. We've proven that across our nation, across maybe the world, but at the same time, I think, surely a contributor of just this is that we, by being here and by talking and trying to educate our people, we're able naturally to find people that don't have any symptoms, and that really helps us. Yes, it does. But on top of that, we're getting people to really be more aware, and really we're catching this earlier, and that's really preventing lots and lots of deaths. Not only the therapeutics, but just getting people to the hospital or getting people treated and aggressively treated earlier is really a big time, key to this whole thing. Look at what happened with our president. Our president has this. What do? Of course, all the king's horses and all the king's men jump on and everything, and they aggressively treated early. And in 3 days, he thinks he's Superman now, and so the earlier we can treat, the better, but Dr. Marsh and Dr. Amjad can answer this a lot better than I.
And it's okay if I go first? Yeah, sounds good.
Hold up. Doc, hold up just one second. It's Jim one more time. Let me just say this. And Stephen, you're right in the fact that it feels like the number of deaths are getting less, and surely today, less. But Stephen, we've lost a lot of people in the last month or month and a half, and so anyway, I just I don't want to celebrate us getting better until we really, really, really are better. But anyway, Dr. Marsh, go ahead.
So I was just going to reinforce a couple of things that you said, Governor. We know that although our tests have gone up now by a bit over twice, the number of positive tests are going up even more, which to me suggests that we are targeting people in areas where we see more spread and we're able to identify them. And these, as we've talked about, these super spreaders are so important in trying to reduce the spread. Again, the 5 to 9% of people that will infect 80% of others. The other thing is that through the DHHR Secretary Crouch and Commissioner Amjad, we've had ongoing calls with the Hospital Association and with the Long-Term Care Association that we have really been able to coordinate in even better ways interactions between all the groups. And then Commissioner Amjad has really spearheaded the strike team approach that we have championed to be able to move very rapidly with General Hoyer's assistance into not only a testing mode, but also assessment of the place and ability to bring help to a facility that might be having problems. And remember, in our state and around the world, over 50% of the deaths of almost everybody's experience comes from people that are older, over 75, 80, and vulnerable, nursing homes, et cetera. So there's a lot of new guidance to do that too. But I don't know if you have anything else to add.
I don't, just to reiterate what the governor said as well, that early detection does help with prevention. Then, of course, as well as the therapeutic intervention that found does help, but nothing else to add. Thank you.
All right, thank you, Stephen. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Good Monday, panel and governor, and happy birthday to your mama, governor. Mine is missed as well, but these are important days. But to the question, I have personal knowledge of someone who was infected with COVID-19. They tested positive, so that kicks in contact tracing. When the contact tracing from the Kanawha Charleston Health Department call came, it limited the question to who have you been in close personal contact with to one person. And then when the person said, well, her limit had been with one person. But then the questioning didn't continue with who that person may have been in close contact with. So at least on this call, it wasn't daisy chained out very far. So Dr. Amjad, Dr. Marsh, how far should we be going with contact tracing with these people who are tested positive? This would only went, 1 degree of Kevin Bacon away, but others had been in contact with that individual, me included. So how concerned should those people be? It seems like it might have stopped a little short in this case. Thank you.
Doc, you guys are going to have to answer this one.
I mean, I'll start and then I'll let Clay go, Kenny. I mean, it's hard for me to say since I wasn't a fly on the wall or eavesdropping on that conversation. But I mean, the contact tracers are good. They're going to ask certain questions. They're going to ask how long the person was in contact, if it was within 6 feet, greater than 15 minutes, and they're going to ask a few of those additional questions. So it's very hard for me to comment on that specific one. They also have to ask, besides those 2 additional questions, those are the main questions. Were you within 6 feet, greater than 15 minutes, and other associated factors, and then other symptoms. So those are the main questions we ask for contact tracing. So it's very hard for me to comment further on that. And of course, they're also going to tell the person if you're having other symptoms or any other questions to get in contact with your doctor or get tested. But I'll see if Clay has any additional information for that. But.
No, I would agree, with what you said. I mean, ultimately, Kenny, what we want to do is make sure that we are getting all first-degree contacts so that we can not only quarantine those people effectively, but perhaps test them as well, and then look beyond them. I would bet that different epidemiologists might approach the second degree and third degree of separation from that person perhaps a tad differently. Certainly the first degree are the key people that you want to identify, but I do know that some contact tracings do go to the second degree of separation as well. I don't know the circumstances again around this, but Kenny, I think as you rightly point out, the more people with knowledge of a potential, of a person who tested positive and either contact with that person or close contact with somebody who contacted that person is important. Remember though, from the study in India and then the study in China, the rate of transmission, even in the same household with a person who's COVID positive, was 9% in India 14% in China. And if you didn't look at family, but just looked at an address, it was 17% in China. So ultimately, the likelihood of anybody getting infected from another person is lower unless you come into contact with one of these super spreaders, as we've talked about before. But that's a really good question. And we will follow up and look at what our standardized approach is at the local health departments with our EPI people.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. The West Virginia legislature is due to convene in about 2.5 months. I wonder what kind of preparations are being made for that, access to you, Governor, from various legislators, how they are going to conduct business. Have you as a state invested in more technology to, make the process a little bit easier and more accessible for the public? Governor?
Well, Paul, first of all, I hope they'll be in contact with me, from the standpoint that we've got to go through an election first, I guess. But from the standpoint of all the different things that are going on within the legislative bodies and everything, I'm talking to the leadership of the bodies, frequently, I welcome, talking to anyone really from the legislature, from either party, anytime. I really think that as we move forward with this, we're going to have a much different session, because I do not think that there will be I do not think that there's going to be a magical cure by the time of our session. Even though it's a little bit later, I really believe that we're still going to have an unusual session. From the standpoint of DHHR, they're continuing to work and do all kinds of work behind the scenes and everything to try to get ready and to try to facilitate and back up and help in every way they possibly can. I guess right at this moment, Paul, another good question, but for the most part right now, I would probably say that the preparations are starting, but the preparations have not intensified to the level that they'll have to be done before we get there.
All right, thank you, Paul. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you mentioned the low testing numbers in Wyoming County, and I think it was the end of last week we talked about relatively low numbers in Doddridge County. Do we know why we're seeing parts of the state with these really low testing numbers? And are there any additional strategies or incentives we're considering to increase testing in these places? Thank you.
Well, I have said it, and you using one of my terms until I'm blue-green. If our National Guard, if the local, the local health departments, if anybody needs any additional help from my end to be able to test more, I'm ready. I want us to continue to test more and more and more. I'm pushing it, and I'm pushing our people, in every way. DHHR, we're very thankful for all the pharmacies that have stepped up and all the different things that are going on there. But Charles, I got my data on that. I think Dr. Marsh gave me the data as far as the low numbers of testing. I'd like you to hear from him on that, but I know that there's also in these counties, our more rural counties and whatever like that. I know that there's problems with getting to people and doing the testing and getting crews that are there, and then there's problems from the standpoint of those people in those counties getting out and getting tested. So, Dr. Marsh, maybe you could add a little bit to all that.
No, thank you for the question, Charles. I think it's a really important one. And ultimately, what we are trying to do is to get people to show up for the testing and make the testing convenient in location and time. And we're continuing to work on that because at the end of the day, we know that the only way to identify some of the people that will spread the virus the most around the county is to test much, much more aggressively. And we also know that because most people in the county will be negative for COVID-19, that by testing a lot, the county also will improve its community spread status as far as the color goes. And that gives us the opportunity to identify even more people in that county. So for a whole bunch of reasons, and as the governor pointed out, every Saturday when the public health panel meets to look at all of the data, we go through any county that is red, orange, or gold. How many tests are they doing? And what we find in a number of the rural counties has been pointed out that it doesn't take very many cases to make the infection rate go way up, but the testing tends to be low in those counties. And as the governor said, we looked at Wyoming County and looked at Mingo County and some of the other counties. And while Mingo's picked up a little bit, Wyoming County still had very few tests done. And so by getting people to really go out and be tested and make sure that they are, understanding what their status is, we get a much better feel for that county and the citizens. And it also, by increasing the number of tests, it starts to reduce that color code on percent positives, which is a pathway to get that community out of the red or the orange back to the gold. And it gives us the opportunity to identify people in the county who could spread to others, again, even at times that they're asymptomatic. But the other thing, I'll just say one other thing is the mitigation measures are equally, if not more important, and people get lax sometimes about wearing masks and being around each other. CDC has told us that the big outbreak source right now are extended family gatherings or friend gatherings where people are not taking the appropriate precautions. So that becomes super important as we're trying to reduce the rate of spread and keep it down in West Virginia.
Hey, Governor, if I could add, this is General Hoyer. Charles, we continue to work, and as the governor pointed out, some pharmacies have stepped up. There are still additional pharmacies, particularly independent pharmacies, that we are working with to get them online. Regional clinics, as well as the federally funded health clinics, and DHHR and the Guard work daily together on those. In addition to that, in our southern counties, we have also been engaged with some church organizations about sponsoring events as well. This morning, Jeremiah Samples from DHHR and I spent about 45 minutes on the phone with some folks from Mango County to work some additional aspects. So it goes on daily. We understand the governor's direction and his orders for us to move forward, and we continue to work to try to be innovative in how we outreach, particularly in our rural counties.
All right, thank you, Charles. Looks like we have time for one more question. We'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor with the Herald-Dispatch. I was wondering with Bateman Hospital, Dr. Amjad, when you were there, did you find that staff members that are not medical-based, like housekeeping and elsewhere, do they have adequate PPE? What kind of PPE do they wear? Have they had it the whole time? Do they have it now? That's what I was wondering. Thank you.
Hi, Taylor. The staff that was delivering the trays at the time when I was on the non-COVID unit, they are wearing surgical masks and the yellow gowns. As far as the COVID unit, they do not enter the COVID unit because they are not wearing full PPE. They deliver it outside and then it is transferred in, and those are using, paper or styrofoam type materials. So, because that's a separate building in the COVID unit. So they do have adequate PPE because it's not entering. So they are adequately wearing the material that they need to wear, but they're not crossing over into the COVID unit.
All right, thank you, Taylor. Governor, back to you.
Okay, everyone. Like I said, it's October the 19th. it looks like it's better from the standpoint of maybe a few less deaths. It's still bad. Our cumulative number and our daily number are holding in there pretty good. Probably, like I said, the envy of the whole country maybe. But at the same time, we've lost 399 West Virginians, and that's it's really sad, and we all want to remember that and remember those. I will say just one thing, I try to make notes as I hear from our experts, as they're speaking. Dr. Marsh spoke of two different types of powers that we had. And one is the fact that we can, and we have the ability now where we didn't have the ability. Remember when test kits were almost impossible to get and all that kind of stuff? But now we do have the ability to test. And so absolutely, the more we test, the more we'll know. Please go get tested. I mean, please go get tested. It has ramifications all across the board. But we will find spreaders, and we will be able to stop this if you'll go get tested. From the standpoint of electing not to be really actively really getting after it as far as the testing, I mean, it has negative ramifications to the counties about going to school or playing ball or all the different things. For crying out loud, I've said it until I can't say it enough. I can't say it anymore. I mean, for crying out loud, we have got to go get tested. The other thing Dr. Marsh said that is our power is wearing a mask. Wearing a mask. I think it was Singapore today. They were reporting on television today that in Singapore they had completely eradicated this disease. Now they wear masks nonstop. Anytime they go outside, it is a mandatory requirement that they have to wear a mask. Well, what does it tell us? It tells us, let's just be smart. We don't want it to be mandatory on any of us. Just be smart. Absolutely, we've got to wear a mask. From a standpoint of Bateman, I want to say one thing. I had enough just intel and gut feeling that things we could do better at Bateman. I mean, that's just all there is to it. So I sent everybody to the fire. I sent Dr. Amjad, I sent Secretary Crouch, I sent all of our medical team and said, you go down there and you talk to everybody. I don't, it's impossible to talk to everybody, but I'm talking about talk to the people in housekeeping, talk to the people on the front lines, talk to the absolute administrator, talk to the CEO, talk to everyone, but get the straight skinny on what's going on. Well, we're on it. It's not perfect, but my gut reaction I still feel was right, and we're going to make it better. We're going to absolutely make it better. From a standpoint of all the other things, whether, play ball, don't play ball, go to school, don't go to school, we're going to continue to work it. It's really tough. It's really, really tough. And I get it. I get it wholeheartedly, and we're going to try to do all we possibly can do while still being safe, and more safe. Anyway, there's sacrifices all across this that everybody's having to make. I get the frustrations, and I get absolutely all the confusion. I get it, and I know how tough it is. We're going to get through this, West Virginia. There'll be a brighter day. But we won't get through this without making sacrifices. It'll be hard. It'll be really hard. We've still got some stormy seas in front of us, but we're going to get there. Thank you all so much.